Well, the full impact of the pandemic has had on mental health is still yet to be determined, but a new study from the CDC shows a staggering number of the suicides are in teenage girls.
Well, that's right, a majority of those girls. Now, the CDC shows that those rates increased by over 50%. Now, joining us live today to talk about this more is emergency room Dr. Jaime Snarski at Palm Beach Gardens Medical Center. Dr. Snarski, thanks so much for joining us today. First, can you talk about what's happening here in our area? Have you seen a rise?
Unfortunately, I have. It's not a common thing we see in the pediatric population, but I have seen more visits during the pandemic, and especially now that people are getting out and about and not afraid to go to the hospitals anymore, coming in for depression or anxiety, and unfortunately even suicide attempts.
Dr. Snarski, obviously suicide would be the worst case scenario for somebody going through depression or mental illness. It doesn't always lead to that. Are there other illnesses associated with that type of thing, mental illness and that kind of stress?
Well, stress can affect anybody, and that can lead to a wide variety of illnesses, especially if people have underlying conditions or are prone to anxiety or other mental disorders like schizophrenia or substance abuse. So definitely the pandemic has pushed some people over the edge, especially due to social isolation and just triggers of not having that social network that they would normally have.
And this finding is so concerning. The ER visits among teenage girls growing. Why is it so significant in girls rather than boys?
Well, a few things, especially in the teenage population. Girls are going through puberty earlier, so they're more aware of their bodies and changes, and that can be a very stressful time. Also, they're more aware of how other people perceive them. And this coupled with social media can be pretty devastating because they don't feel that they can keep up with these images they're seeing of perfect bodies, filtered bodies and faces that aren't necessarily realistic, and they're not quite there yet. So that can take a toll on their mental health. There was also actually a study that said the more time teenagers spend on social media, the more unhappy they are. That's pretty devastating. Also, just in general, boys and girls, just taking these normal social things, gatherings that they're used to during the pandemic. They're not going to sporting events or school events, graduations, proms, and this can be really, an unfortunate thing leading to mental disorders, isolation, leading to depression and anxiety.
We're at time, but Dr. Snarski, thank you so much. Great insight. We appreciate that.